The Centers for Disease Control and Prevention and the March of Dimes have partnered on this, raising awareness about the risk of birth defects from certain antidepressants. Some of these medications can pose a small but real risk. Here to help us understand this initiative, Dr. Siobhan Dolan, a board-certified OBGYN and clinical geneticist, and Jennifer Lind, a pharmacist and epidemiologist. Good morning.
Good morning.
Good morning, Mary.
I think it's important. We've seen the national headlines about this the last 24 hours. Would you take us through the findings of this new study?
Absolutely. So we found that about 15% of reproductive age women with private insurance filled a prescription for an antidepressant. So when you think about that, that translates into about 1 in 7 women of reproductive age taking an antidepressant. And so we're just trying to increase awareness for women to talk to their healthcare providers about any medications that they're taking, including antidepressants, for the reasons that you mentioned. There are conflicting reports in the literature potentially linking some antidepressants to certain birth defects. And so we just want to encourage women to talk to their doctors and have these conversations early.
Why is it important to know how many women of childbearing age are taking an antidepressant? Why is that information meaningful?
I think the information's meaningful because what this study shows us is how common antidepressant use is amongst reproductive age women. So we really need to have the conversations, and we want women to talk to all their healthcare providers. Perhaps they have a mental health professional, an OBGYN, a family doc. Talk to all their providers, and so many women are in this situation, so we really want to encourage these conversations. Talk to your providers. Let them know you're thinking about pregnancy, and then think about how you can optimize your mental health before pregnancy, ideally, or then during pregnancy once you've learned that you're pregnant.
So what do you say to women who want to become pregnant or are pregnant now? Should they stop taking their medication? I mean, I don't know what the answer to that is.
Yeah. So the answer to that is no. They should not stop taking their medication, and we want to make that message very clear. You know, what's important to remember here is there may be some small risks to medications, but there are certainly well-demonstrated risks to untreated depression. So it's not a situation where there's a simple answer.
Right.
It's a situation where the risks and benefits need to be weighed out for each individual woman, and it can look different for different women. You know, some of the things that can go on are women can think about going from 2 or 3 medications down to, let's say, a single medication, and then the best medication to manage their mental health. Other women may be able to engage in talk therapy and find some relief of their depression in that way. So there are a variety of options and no simple answer. But the message is to talk to your doctor about the situation that you find yourself in so you can optimize your situation and have the healthiest pregnancy possible.
So now that you've made these discoveries, you've got this information, how are March of Dimes and CDC working together to help educate women about the safe use of medications in pregnancy?
Absolutely. So CDC and March of Dimes and other federal partners and agencies and the public are working together to provide more information through our Treating for Two Safer Medication Use in Pregnancy initiative. And Treating for Two is really focused on providing better research and reliable guidance so that women and healthcare providers can make informed decisions about treating health conditions during pregnancy.
We've covered a lot of information here this morning, but not all of it. So is there a comprehensive website where you direct our viewers in case they'd like to learn more prior to following up with their doctors?
For sure. We each have a website. So cdc.gov Treating for Two has a wealth of information, as does marchofdimes.org. So as you said, Mary, we encourage women to go there, learn a lot about what particular medications they're taking, learn a lot about the landscape of treatment of depression during pregnancy, and then go talk to their provider and personalize that information to their own health care so again they can have a healthy pregnancy.
I think that's a good place to leave the conversation. Thank you both for joining us today. We appreciate it.
Thank you.
Thank you for having us.
It's our pleasure. Monday.